So first, let me tell you to think of this literally as though your house were on fire. If your house were on fire right now, there would be a lot of fear, and we have a lot of fear in our city. There would be a lot of confusion as people living in the house are running around trying to make sure everybody gets out. There might be many, many mistakes to get made. You might want to grab a certain book and miss it. And there would be general chaos and disorganization. I think that's an apt description for where we are as a country today. So if you're expecting a logical, it's well thought out, but a logical, well fit together, well coordinated plan on how everything's going to work, you've already figured out that ain't happening. And don't be surprised by that. That's not happening anywhere in the country. But let me take just a few minutes to be clear how truly extraordinary the time that we're in is. So this is a pandemic, and I know the news talks about a 100-year event. We'll come back to that in a minute. It's certainly a pandemic where around the world we've seen almost 64 million people come down with COVID-19 and 1.5 million deaths globally. Now, I'll be very honest with you. The actual number of people who probably died from COVID is probably several times more than 1.5 million, but 1.5 million that we can put our fingers on. In the United States, one of the richest countries in the world, we're going to hit 4 million cases very soon. And we're going to hit probably before the end of the year, maybe 270, 274 deaths. This is an extraordinary event to have happened in the world in about 12 months. So the numbers that come on the news every day, and since you all are going to be working on the ground in this area, you should get used to looking at places where these numbers are put out. Johns Hopkins is a good place to keep track of where things are going, not only here in Chicago and in Illinois, but around the country. And as you already should know, what happens in the country is complicated. Some parts of the country are doing better than other parts, and they go up and down. So in Chicago, for one of our most recent data, we think there have been about 160,000 cases that actually diagnosed, about 19,000, 20,000 active cases right now in the city as we sit here. Fortunately, most people recover. About 85% of all those 160,000 people in Chicago that had COVID, about 85% have recovered, or at least are not dead. You know, we have some long-term sequelae that we're just beginning to find out about. And about 2% overall for the city of Chicago, about 2% of people in Chicago that got COVID unfortunately died. This mirrors what's going on in terms of those percentages around the country. So what that means in plain English, that about 1 out of every 19 Chicagoans have active COVID now.